Welcome back to the Aging Project podcast. I'm your host, Shelley Craft, and together, my friends, we're on a mission to age well. Bloody well, if I'm being honest. Let's be real, though. We all need guidance when it comes to aging well, and that's why we've gathered the best possible support team for us. No topic is off limits, and I promise to ask all the right questions. Your questions. Before we dive in, don't forget to join our growing community of women from around the world. Sign up at theagingproject.com.au and become part of the Aging Project community. You'll gain access to our treasure trove of podcast episodes, our free 5-day morning challenge, and did you know we now have an online store called You Must Try It? It includes products we've discovered from our podcast guests and community. Think low-tox skincare, low-tox makeup, supplements, and more. You'll only find products we've tried, tested, and we love at youmusttryit.com. Are you ready to begin today's episode? Alrighty, let's do it.
I am a gynecologist who is interested in women's health and providing a holistic care to women, who is not afraid of calling vaginas vagina, because vagina is, to me, just another organ like nose, eyes, and very precious organ, in fact.
Welcome back. That was today's remarkable guest, Dr Fariba, the founder of FBW Gynaecology Plus in South Australia. Fariba caught our attention after recently winning 2 national Telstra Best of Business Awards for championing health and accelerating women. Fariba is a true women's health warrior, and we are so honoured to give her our platform to share her message, from reducing the stigma associated with female gynaecological issues, which often occur post-birth, to raising awareness amongst the medical community on the need for more to be done to treat prolapse. I get the sense this woman is just getting started. Her passion to break down the taboos surrounding women's health is infectious. We've got you covered today, ladies. Please welcome Dr. Fariba. Wonderful to have you with us.
Thank you. Thank you for your kind introduction.
To understand a little bit more about what you do, how do you explain your job at a party?
I am a gynecologist who is interested in women's health and providing a holistic care to women, who is not afraid of calling vaginas vagina, because vagina is, to me, just another organ like nose, eyes, and very precious organ, in fact, because it has so many functions to it. We have sex with it, we have periods with it, we pass urine, it's an organ that we fall pregnant, and we create human beings. So I am very proud to use the organ the way it is, rather than calling it different nicknames that it really irritates me. So I call the spade a spade.
Well, I'll make sure that I put on my big girl pants today and I call it a vagina.
Good girl. Thank you.
Your personal story has obviously inspired your work greatly and your specialty in this area. Can you share your story with us?
Sure. I was born in Iran. Some people might know it as Persia. When I was 12 years old, the government changed and I found myself on the wrong side of politics. And it was a time that my dad appeared to be executed, and I saw how lost my mother was in her life, thinking as a woman who depended on my dad all her life with 6 children. How could she raise us if he dies? Mm-hmm. And the conversation that she had in terms of prayer to God, it was so different to any kind of prayer that I had heard, that it really affected me emotionally. And it was there and then that I decided I am going to be an independent woman. I am not going to put my children through those kind of emotions if my husband is gone. But it appeared my dad didn't get executed because he was running a big charity. He was a politician, but also had big charity affection, and he loved charity work. And one of the men who actually was supposed to execute him was the husband of one of those women that my dad had empowered and helped. So dad came home on a bike, fleeing from the prison. And when he came home, he put us in a garbage truck, pretending that we are all garbage. And we left the city so nobody could find him and us. And if sitting out among the garbage, I thought, nah, I am going to prove to the world that my dad is an innocent man and a wonderful man, and I am not a garbage. And I made the decision then and there at age 12 to be the person I am today. And I kept going with charity because my dad always believed that if you empower women, if you have healthy women, who give birth to healthy children, you eventually will have a healthy society. So that really was wonderful for me, because Dad was one of a few men who believed in women's rights and equality. And I just wanted to keep that going.
What an extraordinary man, an extraordinary father figure, and an incredible role model for you and your siblings.
Yes.
Fariba, your mother obviously had a huge impact on you wanting to go into this field as well, with her, I guess, mechanics of how she hid her incontinence from the family.
Yes, when I was 5 years old, I remember that my mom would take the children to the toilet, pretending that we needed to go to toilet, but in fact it was her who had the urgency and frequency, and she was covering it up with the children's need. And my dad didn't know anything about her problem and how it affected her and her family, such as her children.
So with 6 kids, she was making very, very frequent trips to the bathroom.
Yes, as many times as she needed. But then later on, the aunties learned from her, and they would take us to the toilet as well. So we had many trips to the toilet during our childhood. And that was when I realized that women's health issues are a taboo subject. And it wasn't any religion, it wasn't Islam or anything like that. It was Shah time, it was very, liberal government. Mm-hmm. But still, in our own household, my mother was suffering. And then when I couldn't study medicine in Iran, I had to go to Germany to study medicine. Because, as I said, we were on the wrong side of politics to punish the parents. They wouldn't allow education to the children. So I went to Germany, and over there, women wouldn't talk about their genitalia, and they had nicknames for their vaginas, and they wouldn't talk about painful intercourse and so on. And I said, oh, that's not just my country and Middle East. It is also Europe. Mm-hmm. Then love brought me to Australia, and we are talking about 30 years ago. And when we went to the church and communities, I saw that women in Australia don't talk about this kind of thing either. Everything is happy to talk about pregnancy, vaginal birth, natural birth, cesarean section. But what happens to that woman after those children? What happens to the body? This baby is coming out of the vagina. This baby is carried for 9 months in the womb of a woman which is pressing on the pelvic floor, but nobody is interested. And you even lose your name after that baby is born, because you become the mother of that child. You don't have even a name anymore. So it seems that not the society is interested in the body of the woman after childbirth, and not the Medicare is interested, because all the money goes towards reproduction and IVF and fertility and so on.
Well, I guess it's sort of comforting to think that this is a worldwide problem. It's not just how we discuss our body parts and don't discuss our body parts here in Australia. But that should also be empowering, that we can all be in this together. We are at least half the population on the planet. It's time we took charge of our vaginas, isn't it?
Exactly. I am 100% with you. It's time for us to have dinner parties talking about vaginas.
Amen to that. I'll tell you, I caught up with some girlfriends last night, and I brought this up to the topic of conversation, and they said, Shelley, I just don't think this is dinner conversation. I said, if it's not dinner conversation for us, Who is it ever going to be dinner conversation for?
Exactly.
I've discovered a place that's all about empowering women's health, and I wanted to share it with you. It's called Vera Women's Wellness. Led by the amazing Dr. Peter Wright, an integrative gynaecologist and fertility specialist, Vera Women's Wellness is a haven for personalised, holistic care and support. I think what sets them apart is their philosophy. They believe that every woman deserves time, space and compassion in their healthcare journey. They listen to your stories and empower you with knowledge to get to the root cause of any concerns you may have. We love promoting people and brands we trust, and Dr. Peter and her team at Vera Women's Wellness are the perfect example of that. You might recall we interviewed Dr. Peter on the topic of menopause in season 1 on the Aging Project, and we love her. So whether you're dealing with gynaecological issues, fertility concerns, or simply want to achieve your best health, Vera Women's Wellness has got you covered, ladies. Visit www.verawomenswellness.com.au to book. And yes, they offer both face-to-face appointments in Brisbane and telehealth appointments if you're located elsewhere. They've got gynecologists, GPs, psychologists, dietitians, and trauma experts on hand. Remember, ladies, your well-being matters. And Vera Women's Wellness is here to support you every step of the way. One thing I've learned during my time on the Aging Project, just because something is common amongst women, it doesn't mean that it's normal. And I think even when we are having these conversations with our girlfriends, if we're lucky enough to be that open and honest, perhaps I would say never with our mothers, that if you do come across things that you're all experiencing, that doesn't make it normal, it makes it common.
Yeah. If I tell you 69% of couples have sexual dysfunction at some point in their lives, it is not normal. It is abnormal. Mm-hmm. So it means we have to do something about it. It means we have let it go too far for that to become the majority of time. And we are going with the current diet, with the current medicine available to everyone. We are going to live up to 120. Do we want to smell like urine and feces for the rest of 70 years, or wear a pad for 70 years? I'd rather die. Okay. So then.
This is great motivation, Fariba. This is excellent. No, we do not want to. Obviously, sexual health is one enormous part of good vaginal operation and vaginal health. What are the problems that you see, and I guess the common ones that you have coming into your practice that we're probably all going to experience, having had babies, not had babies, had cesareans, had natural births, perhaps birthed no children, but coming into perimenopause and menopause? What are the common things that we're all going to experience?
Okay. Menopause will hit all of us. The average age of menopause is age 53 in Australia. So when we say average, it means some people go through it before, some people a bit later. After age 40, the estrogen level decrease in the body, and different women react differently to this drop of estrogen. Hot flushes, low libido, low energy, vaginal dryness, urge incontinence, stress incontinence, and at times urinary tract infection, bacterial vaginosis, as well as prolapse. And this is, we used to call the vaginal dryness as atrophic vaginitis, but now we use a different terminology, call it genitourinary syndrome of menopause, which is a spectrum of symptoms that can happen due to lack of estrogen.
Mm-hmm. So this is GSM, is it? This is what we'd refer to with our doctors? You're right.
Yes, GSM. And that is very common. After, 50% of women after age 60 will have this condition, and about 60% after age 70. So it's very common. Mm-hmm. And it is best if we take care of ourselves before we go through menopause or at the time of menopause, and a really basic vulvovaginal care is something that can help us. What is the vulvovaginal care is that G-strings are the worst thing that ever happened to women. Polyester underpants are not good for us. washing ourselves obsessively with soap, applying perfume, or those chemicals that we do for reducing the smell, or bleaching the vaginas, that are awful. So we have to prevent as much chemical there as possible. Also, a diet is really important. Low oxalate diet, reducing spinach and so on. Adding zinc and probiotic as a supplement is really good for our vaginas. You can take the probiotic vaginally. Some women, as soon as they have smallest symptoms of urinary problem, they go and put themselves on antibiotics. That's the worst thing that you can do, because you kill all the good bacteria as well as bad bacteria to get rid of the an infection that might not even exist. Mm-hmm. And that's why it's important that if we go on antibiotic, then we take the probiotic at the same time. And remember, vagina and rectum are very close to each other. And just by act of sitting, standing up, our underpants could move between the bladder and bowel. It's not that women are dirty or anything like that cause themselves infection, but it is because of the lack of immunity, local immunity in the vagina, that is, we cannot fight the day-to-day infection that the vagina would normally do. So basically, vagina is like a self-cleaning oven, like eyes. If we have something in our eyes, it basically we start to have tears, and we make sure that it is out of the eyes. But sometimes this function is lacking in the vagina, and the infection stays there and the irritation stays there. Often women come and say that they have painful intercourse at the entrance of the vagina, that they have fissures when they have intercourse, and that they might bleed, or that they have urinary tract infection after intercourse. And sometimes it could be that they can't orgasm or get aroused anymore because the vagina is so dry, and therefore there's no point of having sex, or the libido drops because they associate pain and sex together. So why would you want to have have pain when something should have been pleasurable? Mm-hmm. So now I get a lot of women. It has taken women a long, long time to talk about this, because they either put up with it, or they go to bed before their husband goes to avoid the husband, or they allow the husband to sleep and then go to bed. So they pretend that the day-to-day life has been in the way. And that is not good, because actually being sexually active after age 40 is much more important than before. I think that sex is wasted on the young people because they don't understand the science behind it. What is really important is that having intercourse 3 times per week reduces the risk of a stroke by 30%, heart attack by 30%, as well as depression by 40%. And this is not a study that gynecologists have done. This is a cardiology study. It increases the levels of testosterone, which is really important for women in terms of focus and memory, and in terms of energy. It works like 3 milligrams of Valium, which you can sleep much better sleep, and it reduces the tension. And women who deal with pain, it increases the pain threshold for women when they are sexually active. And there are some studies that are saying if you have sex twice a day, you live 8 years longer. But I think I will give that a miss.
But you are saying mount up, ladies. It's just, This is good for your health. But I guess there's a lot, as you were saying, there's a lot of anxiety that comes with that, whether it's due to pain, whether it's dryness, whether it's just long term with one partner, and perhaps the boredom has kicked in. But I think it more comes down to that. I know this isn't going to be as pleasurable as it was. So how do we sort of prepare for that? Is it about lubricants? Is it about, as you said, getting our zinc levels right, looking after our vaginal microbiome? How can we make this a happy place?
All of it. First of all, thinking that you deserve a good quality of life. And that the sex is not just the pleasure, but also the medical benefit and the quality of life that it gives you.
So running, Pilates, meditation, sex. This is very important for us.
Yeah. No, I think you should put sex on the top, because sex has given us much more. Yeah. So have sex and then go to Pilates, have sex and then go to yoga and so on. Because the benefit is much better than those things give us 10% protection for heart, brain and everything. Sex is much higher than that. But besides, we are now having a bit of human fun. It is really important that we know estrogen are available. There are vaginal estrogen or vaginal tablets available that are estrogen based. Mm-hmm. But 7% of our women have breast cancer and they might be hesitant to use estrogen. So for those women, it is really important that first of all, keep having the intercourse is important, because if you don't use it, the vagina shrinks. That is the nature of the menopause. The tissue becomes fibrotic and hard. So having mechanical dilatation of the vagina is actually good. And you can prepare yourself with dilators, with sex toys, and so on. And if the orgasm is difficult, you can add the sex toy and introduce it to your sex life and jazz it up a little bit. So you have to be a bit lateral thinking. It's not really one set of rules that applies to different women. Some people hate it, some people love it. So you have to find something that works for you. And I see often men are more amicable to this kind of thing than women are. So women are more conservative in bedroom than men are. So I haven't heard a couple who come to me saying, the man never says, "Oh, I don't like that." It's always the woman who says, "Oh, I don't want that."
Back in season 1, episode 12, we learned about the benefits of collagen from the amazing Dr. Frank Lipman. It was that conversation that saw us researching the best possible collagen products we could find for us and for you. I'm excited to say our favourite brands now available inside our sister platform and store, youmusttryit.com. You'll also find a range of fabulous products from gynaecologist Dr. Anna Kebeka, who we interviewed in season 2. I absolutely love her maca powder and keto green protein power. After today's episode, perhaps go back and listen to episode 2. It's called Let's Take a Menu Pause with Dr. Anna Kebeka. It's worth a listen. Okay, my friends, now back to today's episode. It's interesting, Fariba. I know you're not a relationship counsellor as such, but I guess whether you've been in a long-term marriage, whether it's a new relationship, I guess that conversation is always different. I would imagine it would be quite tricky to say to your partner, long-term partner, it's just not doing it for me anymore, but I would like to continue with this. It's not that you're not enough, but I need a little bit more now that I'm in perimenopause and menopause.
Yeah, no, it's actually, men are actually much more amicable than women are. So in my experience, I make sure that I see women with men when they have painful intercourse. Because when the things that I explain to men, the women are not able to explain. I make it scientific. I make it about both of them. And I said to every man that women's health issues are not women's issues. There are couple issues, there are family issues, there are society issues. So unless they get in and help, I can't help them. Mm-hmm. And I have even something that I say, every man needs a gynecologist, because if I tell them what the woman needs, they understand it better. So post-op surgery, I never see the woman alone for any consent form. I said, bring the partner, bring the support person, because this is what he has to do or she has to do. Mm-hmm. And I hardly see any man objecting to anything that I tell them. And at times women tell me, "Oh, my husband is so understanding. He doesn't care that we don't have sex." And then when she leaves the room, the man actually cries to me and says, "I do actually care, but I don't want to hurt her." Mm-hmm. So if you have a partner who says, "I understand," they do understand, they do love you, but they might be suffering in silence. Mm-hmm. So it is much easier to tell them, "Look, I am going through menopause. Let's go and see a gynecologist. Let the gynecologist tell you what's going on with me. It's not that I don't love you, but my body is not the way it was. there are things that we can use to jazz it up, and maybe there are hormones that I have to take, or I don't want hormones, but maybe there are lifestyle that we can have, and so on. And you will see that the boys join in and understand, and they will be the first people who buy any kind of sex toy that helps you to have a good sex life together and to be more intimate. Mm-hmm. Just give it a go.
Yes, that's right. Give it a go. You can't say no until you've given it a go.
That's right.
So what can we do? Obviously, again, we're taking care of that area, and we don't want to introduce anything that's going to cause more harm, which I can imagine a lot of lubricants and things won't have any goodness in them, that they are going to do us more harm than good. Do you have any products that you recommend, or are we meant to be fixing this from the inside and not necessarily from the outside?
No. The best lubricant is the vegetable oil. The very ordinary vegetable oil in your cupboard. Please don't take it as a 2-liter container to the bedroom, make it a bit sexier and put it in 100 ml bottles. But coconut oil is really good. And that is the best lubrication. Don't buy any chemicals off the shelf, because they always have a little bit of chemicals to it, and that might irritate and that might cause problem. So that is number one. Avoid soap. Avoid undies at night. So nightie and no undies, let that air. Especially women who are a bit bigger, on the bigger side. So when you go and have a shower, dab yourself and take the hair dryer and dry yourself. So that reduces the risk of fungal infection, because fungus likes moist area. And if you do things like that, you will see that a lot of things happen. There are some lasers on the market, but some doctors believe in it. Some research doesn't, but it's a controversial area. And some people are also using PRP, which is platelet-rich plasma, that is taken from your own blood and is given to you. Is usually used for the face or for facial rehydration, but that can also rehydrate the area down there. But all of this is being researched. The good thing about it is it is not harmful, but the benefit of it is still being researched and being looked at.
So PRP is an area that you have been working in and researching.
Yes.
As you say, we've heard of the vampire facials, which I guess is that plasma. How does that work in the vagina? Are you injecting that into the vagina?
Yes. The way, the very first time that I did the PRP was for a lady who was 30 years old. And she really confronted me with GSM at age 30. She had both breasts removed for breast cancer. She also has lost both her ovaries, and now she couldn't be intimate. And during this process, the husband had left her. And now she was in a relationship with a boyfriend, and now they couldn't be intimate. So she asked me, what's the point of living and prolonging life if there is no quality of life? I can't be a mother, I can't be a lover, and I can't even sit and perform, do a job. And I said, look, there is this product called PRP. That is from your own blood, that doesn't have any hormones. And she had estrogen receptor positive, and the doctor had told her, no, with estrogen. And we tried that for her. And a month later, when she came back, she said, doctor, I think since I have the chemotherapy, my skin doesn't look good either. Can you put some of that PRP in my face? So that was my first encounter with PRP in gynecology. So we wrote to 100 GPs and requested the same condition, women who cannot have the normal conventional stuff available to us. And we had a lot of women with lichen sclerosis. We had a lot of women with vaginal fusion who didn't respond to estrogen. And we started our research from there. And then we went into lasers. And now we are doing laser and PRP, because PRP, you have to inject it. And laser gives us the option of causing the micro trauma for us. And then we can pour the PRP over it rather than hurting women. So make it a painless treatment. And we are looking up all the aspects, and we are publishing as well with the procedure in our hand. And we had quite a bit of success. I reduced the risk of prolapse repair quite significantly in my practice. And a lot of women have responded to this. And those who didn't respond, we basically offer them other stuff or maybe do surgery for it. But as I said, it is still, we research everyone who comes and has this treatment. We put them in the database and we look at their outcome and so on. But there are some exciting evidence coming out, but the jury is still out.
What an extraordinary body of work, particularly for you to be exploring and being the forefront of.
Yeah, thank you. And that PRP actually has been used in many other specialties as well. Not only dermatology, musculoskeletal people use it. A lot of orthopedic surgeons use it. So there is, as I said, a lot of controversy around it as well. But it is like with any innovation. Some people are early adopters, some people are later adopters. But the good thing is that people are looking at it. And the best news about it is it does not cause any harm. It might not work, but it doesn't cause any harm. While recently there was a publication coming out of Denmark that women who have breast cancer are on aromatase inhibitors, the vaginal estrogen can increase the risk of breast cancer recurrence by 30%. So if you take the estrogen cream from women, then you have to supplement it with something. Okay, diet is good, vulva care is good, but there will be a woman or two who don't respond to this, and they should have other options available.
So is this something that you would obviously speak to your gynecologist about, but is it now, there's papers out there, obviously you are doing the work. Is it common knowledge that PRP is available for this?
No. As I said, we are doing it all in the body of research. They know that this is available, but the body of research has to be randomized controlled trials, which we are doing it at the moment in my office. But some people say, look, the evidence out there is enough for me. And I know that it is not harmful, so I want to have it. So we don't say that this is normal conventional medicine. We say, look, this is available, but we tell them that it's controversial. We tell them that, this school of people, this school thinks that, this school thinks that. We give all the papers, pros and cons to the patient to study. And if they still want to go ahead, then we provide the treatment for them.
Right. But for normal common GSMs, it really is just making sure we're having enough zinc in our diet, pushing through the pain and coming up with more creative ways to go about your sex life, treating ourselves a little bit better, and of course making sure that our microbiome is healthy.
Yes, microbiome, healthy diet, healthy vulva care, and estrogen cream, and vegetable oil, and the frequency of intercourse will help maybe 80% of people.
A quick pause in today's episode to share some of my must-try products at youmusttryit.com. Through the Aging Project, I've learned managing stress is something to be intentional about, which is why over at youmusttryit.com, we've created a stress and sleep page with all of our favourite products. After today's episode, go check out the Shakti mat. This is an acupressure mat with over 6,000 spikes. Yes, I swear by it, as do so many of our customers. Even previous guest, Dr. Peter Wright from the Vera Wellness Clinic said, "I love this mat, Shelley. Thank you." It is my pleasure, Dr. Peter. To grab yours, just go to youmusttryit.com and type Shakti. That's SHAKTI. You'll also find essential oils, supplements, and organic teas, all designed to reduce stress and aid sleep. Trust me, all are a must try. Just go to youmusttryit.com for a 10% discount off your first order and to join our community. The good news is we also ship internationally. Yes, we do. Alrighty, back to the show. I would love to speak to you about your charity, Desert Flower. Can you explain to us how Desert Flower came about and what work you do there?
Yeah, Desert Flower South Australia was established in 2018. I am a gynecologist with interest in pelvic floor disorders, so I do a lot of prolapse, incontinence, and also reconstructive surgery. And I've also worked with a plastic surgeon in the past, and I knew how to do fat grafting and how to, for example, I do a lot of charity overseas as well, and we see a lot of women with genital trauma and genital scarring. And sometimes the genitalia is as if, you have no cheek on one side. It looks really lopsided. So I knew how to take fat from the tummy and inject it in the labia to make it symmetrical. And then a couple of women who were survivors of female genital mutilation came to me and said that they are dating Australian boys and they don't want to be the way they are. They want to reverse their mutilation. And I did it for them, and it was quite successful. And a few years later, it was 2010 that I did the first one. The No FGM Society, which is not in existence anymore, came and said, could I be a voice for these women? And I said to my husband and my daughter, this is extra work I was asked to take on board. Are you guys with me? And it was my daughter, Nadia Willison's 21st birthday, when she said to me, Mom, I am 21. I want to have a good party, but I really have everything that one needs for day-to-day life. I don't need extra presents. And why don't we do a charity gala dinner? So we did that, and to our surprise, 400 people came, and we raised quite a bit of money. And I was moved. I was really moved that so many people are interested. A couple of politicians came and promised support. So then I thought that myself and my colleague, Dr. Tran Yuan, will go to Austria and talk to Desert Flower Austria, who has an Ethiopian model. There is Waris, who is talking to United Nations, and who wrote the book The Desert Flower, and see if they could teach us how to do these procedures. And we met with them in the hospital in Germany. They showed us their protocols, and I showed them mine, and we decided that their protocol is really invasive, 14 days in hospital and flaps and so on. I showed them how I do it, and they were actually quite interested in the work that I had done. And they said that we could use their name and we could use their constitution. But because their name had the African continent as a logo, I thought Australia is multicultural, and by just singling out one country, it will cause prejudice and it causes discomfort to these survivors. We want to show them our love and support. We want to, and we thought, okay, what do we do with the logo? We thought, okay, these people are the desert flowers from another country. They are coming to the Australia. Let's have an emblem of Australian native flowers and call them the desert flowers of Australia, who are going to be empowered in this country. And because of the opportunities that they have been given in this country, they will contribute to this country even more and make this place a better place. Exactly like myself. I came here as someone who didn't have any opportunities in her own country, and Australia gave me opportunities. And all my thoughts is, how do I leave a legacy behind for this country, and what do I do for this country to say thank you to them? Mm-hmm. So then we came back, we established the Desert Flowers and Desert Flowers South Australia. The Ashworth Hospital in Adelaide supported us and didn't charge any woman that was uninsured. We did the surgery for free if women couldn't afford it. I never charged. My daughter's company, Evon21, gave their products. The nurses, the anesthetists didn't charge the patient for their services. So it was just a wonderful community work that we did together. But unfortunately, COVID hit and we couldn't have a opening of the center, but we are going to do it this year. And I have been interviewed by ABC and SBS, and they are promoting that as well for us. So that's how we established. And PsychMed also is helping us with psychological health, because these women need holistic care. It's not just a cut that you undo. This trauma that they have gone through at age 5 or 6. And now it's something that has been very normal in their country is something abnormal in this country. So we have to assist them socially and emotionally and psychologically as well as physically, how to integrate into this country without judgment. Some of my colleagues said, that makes me so angry. And my message to them always is, please, these women don't need your anger. These women don't need our judgment. These women actually, in their own rights, in their own country, thought that they are celebrating and getting into womanhood with this procedure. It is not that their mothers didn't love them. It is just a culture, and with education, we can change this culture. I'm sure there are a lot of things that we do in this culture that looks bad to the other people. So let's not judge each other. My job is looking after women, love them, support them, respect them, and tailor my work to them individually to address their social, emotional, and economical needs. And that is the best thing that we can do.
Well, we can certainly help with that by promoting Desert Flowers of Australia. I think our listeners would be surprised to hear that there would be around 200,000 women living here in Australia that have gone through female genital mutilation, which is, as you say, a horrifying number worldwide, 2 million survivors of this. 200 million women.
Yes. Every 10 seconds, a child is being mutilated. So, and this is a global problem. This is not an Australian problem. So, I think with the women shattering their ceiling glasses, and with new leaders, female leaders coming to the forefront, it is our responsibility that we will help other women without judging them. And not limiting our efforts to one country. We are cosmopolitans, we are citizens of the world. And every woman that suffers should be a matter to another woman.
Fariba, I think it's important for our audience to understand what female genital mutilation actually is. And I hope it's not too gruesome a question for you to answer for us.
No, not at all. According to WHO, the female genital mutilation is an unnecessary medical procedure performed on the genitalia, which always includes removal of clitoris. There are 3 different types of female genital mutilation, and the type 1 is just removing the clitoris. Type 2 is removing the clitoris and the labia minora. And the third one is clitoris, labia minora, and part of labia majora. And usually these procedures can cause severe scarring and severe urinary problem, and very often intimacy issues.
Well, this is where we can really put into practice our paying it forward. We've learned today from you, Fariba, how to look after our own vaginas and our microbiomes as we're heading into perimenopause and beyond menopause, how we can have a wonderful, healthy, safe and exciting sex life in the later second half of our lives, right through, as you say, to 120. That's what we should be aiming for. It should be fun. It should be enjoyable. It should be something, as you say, that is treasured amongst partners. And of course, now we have the opportunity to be a part of Desert Flowers of Australia as well, and really do our bit for women worldwide in bringing not only recognition to what they've been through, but, as you say, support, funding and help. And I love the quote that you use, with love, one can transform into flowers. And you are certainly doing that for so many. And my goodness, I hope we help you with that with our chat today.
Thank you. Thank you for all your support. I am a person who treats one person at a time. But it's amazing the power that women like you have, because you are broadcasting to 1 million women, and you change women, more, 1 million times more than I do one at a time. well done. So thank you to you.
Well, thank you. We're just here to give you a platform to facilitate your message, which we have heard loud and clear today. Dr. Fariba, we will have show notes on where people can, of course, donate to Desert Flowers Australia. I hope, as you say, with the pandemic past, that there can be beautiful events throughout the country to support this fabulous cause. And I know that the Ageing Project will certainly jump on board with that and beyond.
Thank you for all your effort as well. Thank you very much for having me.
Oh, where do I begin? What an absolute pleasure. We only spoke for 40 or so minutes, but oh my goodness, I have a deep respect for Dr. Fariba, the founder of FBW Gynaecology Plus in South Australia. We covered a lot of ground. I feel like we've been given a much-needed masterclass or a manual for good vaginal operations. Thank you, Fariba, for helping us become more comfortable with this important topic. And the word vagina, why is that such a thing that makes us giggle or blush or be shy? I don't understand. As she said, it's just another organ, and a really important one at that. We hear so much information about gut health, but very little on vaginal health. So here's a few takeaways. No G-strings or polyester undies, ladies. Obsessively washing with soap is out, as are undies in bed. Zinc and probiotics, which you'll find at our sister store, youmusttry.com, are in. And while you're there, you might like to check out our range of sex toys. They're a lot of fun. Give it a go. We've got a few for you to have a look at. And let's not forget about our vegetable or coconut oil. So many great tips for our self-cleaning ovens. What a great analogy. Don't forget to support us by forwarding this episode on. Let's share Dr. Fariba's message far and wide. That is a wrap, my friends. I'm Shelley Craft, and don't forget to join me over at theagingproject.com.au. I would love to see you there. We'll chat again soon. As always, the Ageing Project podcast is for educational and entertainment purposes. Always seek medical advice from a qualified practitioner.